In 2000, I was diagnosed with COPD, advised to stop smoking, and being a fool, I wasn't too bad, so I carried on smoking. In 2014, I was admitted to the hospital twice in a month with breathing difficulties. I was again advised to stop smoking and attend rehab. Viewed rehab as my last chance, and I've attended ever since. Before I started pulmonary rehab, I was really struggling. I couldn't get upstairs. I couldn't walk more than 50 yards without getting into difficulty. Any activity, physical activity at all, left me breathless. As a result of that, I panicked. I didn't know how to get my breath back. And I was a complete mess. And the wife used to say to me, calm down. But you can't calm down when you can't get your breath.
Pulmonary rehabilitation is a 6-week course where patients with chronic lung disease come to do a 6-week course of education and exercise. And pulmonary rehab will teach them that it's okay to be breathless when you're exercising, that's actually normal. And it gives them confidence to then go on and exercise at home, and the exercise will recondition them so that they find that their everyday activities are easier and maybe be able to do things that they haven't done for a long time. So it builds confidence and sort of launches them into the rest of their life, really.
I did feel nervous because I'm the same as everybody else. I have a perception about a gym. You know, all these young, fit, healthy men in leotards, pumping iron. But when I attended, walking into a class, into a gym with people you don't know is a bit of a problem. But the crowd I was with actually made me welcome. And my perception of a gym changed because although I was set a program, I wasn't pushed to do it, I was motivated to do it. And I found that in the end I could do it, and each week I could do a bit more.
There's also an educational component which builds on itself each session. So we talk about things like how the lungs normally work, what can go wrong with lung disease, and how that might impact on their symptoms.
You're with a lot of strangers, and there's people talking to you that know what they're talking about, so you sit and listen, and afterwards there's a question and answer thing, and you're talking to people who have the same or very similar condition to yourself.
So it's up to you now to say, well, I've had enough, it's affecting my lifestyle, my mental attitude, so I now need to take the first step and get to the gym. And it was marvellous. Once you started exercising and using the techniques you're taught, that your attitude to your illness will change.
It benefited me because it made me realise that I wasn't on my own, that other people had got it, and a lot of people that had got it seemed to be worse off than I was.
It's benefited me because, as I say, the education and training taught me how to control my breathing, how to recover my breath. So when I do activities, I'm not frightened now, my mental attitude's changed. I can attempt physical activities, knowing full well that if I do get into difficulty, the training and techniques I've been taught will help me overcome those.
The main thing I can do now is I can walk up the garden in one go.
If you don't attend all the sessions, then clearly you won't benefit from it. So they need to understand that really. It is a commitment and it is hard work, but the staff here are very keen to support people to get through it. And we tell them right from the start really, it's hard work, but if you put the work in, then you'll reap the benefits.
I think, well, you've done the 6 weeks, you've done the hard work, you've got through the gym, you've made friends, so why throw it all away? Just keep it on. It doesn't get any more difficult, it gets easier.
Come to rehab and try it. Come for the 6-week course. You don't have to say anything if you don't want to, but you will meet people that are in the same position as yourself, or maybe worse, or some won't be quite as bad, but you'll hear lots of different stories from lots of different people of how they're coping, and it sort of opens your mind a bit.
Patients can be referred by their healthcare professional, either in the community or in hospital. If they've had a recent admission to hospital, then they will be fast-tracked and assessed within 4 weeks of discharge We will also fast track any patients with pulmonary fibrosis.